Hello and welcome to Pregnancy Info. Today we will discuss the topic, how can we conceive with a twin baby? It's a very interesting question and every female wants to know the answer. There are many myths about how to have twins, although there are no proven ways to increase the likelihood of conceiving twins. There are certain factors that can make this type of pregnancy more likely. Twins can occur either when two separate eggs become fertilized in the womb or when a single fertilized egg splits into two embryos. Doctors do not fully understand the reasons why twin pregnancies sometimes occur. However, some factors can increase the likelihood of giving birth to twins, including the woman's age, having a family history of twins, having fertility treatments, etc. Conception happens when a sperm fertilizes an egg to form an embryo. However, if there are two eggs present in the womb at the time of fertilization, or the fertilized egg splits into two separate embryos, a woman can become pregnant with twins. There are two types of twins. Number 1. Identical twins. This type of pregnancy happens when a fertilized egg splits into two separate embryos. These embryos are monozygotic, which means that they have identical genes. Identical twins are the same sex as each other and look very alike. Non-identical or fraternal twins. This type of pregnancy occurs when there are two eggs present in the womb at the time of fertilization and sperm fertilize both of them. These embryos are dizygotic, which means that they don't have identical genes and may not be the same sex. Prenatal twins are common after fertility treatment because healthcare professionals often place two fertilized embryos into a woman's womb to increase the chances of a successful pregnancy. How common are twins? Twins are relatively uncommon according to the American Society for Reproductive Medicine. Only approximately 1 in 250 pregnancies results in twins. However, the birth of twins has increased significantly alongside the rise in the use of fertility treatments and with more women choosing to have children at a later age. Since 1980, the birth rate of twins has increased by more than 75%. What increases the chance of twins? Several factors can increase the likelihood of a woman conceiving twins. These include, number 1, family history. A woman has a slightly higher chances of having twins if she has a family history of twins. A family history of twins on the mother's side increases this likelihood more than a family history on the father's side. However, this only applies if conception takes place without the use of fertility treatments. Number 2. Fertility treatments. The ASRM note that the main factor that increases the chance of having twins is the use of fertility treatments. The various types of fertility treatments available increase the likelihood of twins in different ways. Some fertility drugs work by stimulating a woman's ovaries, which can cause them to release more than one egg. If sperm fertilize both of these eggs, this can result in twins. Number 3. Age. According to the Office on Women's Health, women who are aged 30 years or older are more likely to conceive twins. The reason for this is that women of this age are more likely than younger women to release more than one egg during their reproductive cycle. If sperm fertilizes two separate eggs, a twin pregnancies can occur. Height and weight. The ASRM report that non-identical twins are slightly more common in taller or heavier women than they are in small women. The reasons for this are not clear, but it may be due to better nutrition. Women with a higher body weight may have more resources available for a developing fetus. Racial background. In the US, Hispanic women are likely less to have twins than non-Hispanic white women or black women according to the ASRM. There are many unproven claims about how to increase the likelihood of conceiving twins. Some people advise following specific diet or certain alternative therapies, but there is no specific evidence to support these methods. Medications. Medications designed to increase fertility typically work by boosting the number of eggs produced in women's ovaries. If more eggs are produced, it's also likely that more than one can be released and fertilized. This occurs at the same time, causing fraternal twins. Supplements. Folic acid is a B vitamin. Many doctors recommend taking it before and during pregnancy to reduce the risk of neural tube defects like spina bifida. Prior to becoming pregnant, doctors recommend taking about 400 micrograms of folic acid per day and increases this amount to 600 micrograms during pregnancy. IVF. Drugs are also a part of IVF, but one of the main factors that increases your chances of twins with this reproductive technology is the number of embryos you decide to transfer. Some couples choose to transfer just one, while the single embryo splits and turn into identical twins. This is not too likely. The more likely scenario is with regard to prenatal twins. If you transfer two or more embryos and they both successfully implant and develop, twins are on the way. The rate of twin pregnancy with IVF with fresh embryos is 12.1% for women under age 35 and 9.1% for women ages 35 to 37. A twin pregnancy increases the risks of premature birth, low birth weight, stillbirth, disabilities at birth, and congenital health conditions such as cerebral palsy and autism, preeclampsia, diabetes during pregnancy, cesarean delivery needing bed rest while pregnant. So, there are many factors that can affect your pregnancy, and you may have twins naturally by following the tips described in this video. Must share this video with the friends and family members who are interested to have twins baby in the pregnancy. Take care. Bye-bye.